All right. Hi, Olga.
Hi. Hello, everybody.
Thank you so much for joining us.
Thank you for
We're
having
so excited to have you. We are going to go ahead and give you an opportunity to just introduce yourself, share anything at all that you would like to share about your background with the students. We have a lot of students at City College that are wanting to pursue nursing. There's a couple different ways that our students can approach it. They can either declare their major as biology and pursue the allied health track, which will ultimately prepare them to apply to a nursing program. And then we have other students who might take alternate routes, right? So anything that you think you might be able to share to help give them any advice, any encouraging words. As I do recall that one of my very first majors for myself that I decided that I wanted to do was actually nursing, but I did not have a lot of support when it came to the science classes and understanding like all of these concepts and things like that. So unfortunately, I made the decision to rethink my career at that time so I could pursue something else that I felt that was not as challenging in terms of all the new terminology. So again, welcome and feel free to introduce yourself and share anything you can with our students.
Thank you. Well, my name is Olga Ramirez. I was born and raised here in San Diego. I have three kids. I'm 35 years old, and I've been doing nursing for about 12 years now. 5 of those years as an RN and 7 as an LVN prior to getting my RN. I don't see myself doing anything else. I love the nursing philosophy. I love just everything about it. So I'm always very excited to be able to share my experience, my journey to how I got to where I'm at, and of course the plans that I have, because there's so much that you can do with nursing. So I'm very excited to be here, and I'm very excited to be able to help anybody during the journey, during making that decision to that's what they want to do. So I'm happy to be here, and thanks for having me here.
Of course, we're so lucky to have you. We have a couple questions prepared for you, and we're going to go ahead and start, okay? And then just answer as best as you can. There might be some things that maybe you might have a question about, or maybe you can't answer it, and that's totally fine. We have a couple questions. We can move on to the next one, okay?
Perfect.
Okay. And I'll go ahead and hand it off to Chris to pose the first question.
I'll ask the first question.
All right.
Would you say your journey to becoming a nurse was easy? What inspired you to choose this career path?
So it was definitely not easy. Originally, I wasn't sure what I wanted to do, but I did know that I wanted to do something where I felt I was making a difference in someone's life. I knew that I wanted to do something where I'm thinking long term, something that I love helping people. So that was something that I knew that I wanted to do. So I had a friend actually that was in the nursing program, and he encouraged me to do something. So I actually took a patient care technician program, which was like a 9-month program, just to get my feet wet. I ended up falling in love with it. I loved patient care. I loved meeting people, having those connections, and just learning. So that's when I decided, you know what, I think this is for me. It was not easy. The route that I took was I went to a private school, an accelerated program for the LVM program, because I already had children, I had to work, so that's something that worked for me. After that, I did the RN program with 2 kids and pregnant throughout the whole program. So it was definitely a challenge. I definitely recommend to be very prepared and really work on that time management. That time management is really going to help make things a little smoother, because it's not easy. There's a lot of studying, a lot of memorization. You have clinicals, and that's just, aside from your personal life, if you have children, if you have a full-time job. So it's definitely not easy, but it's definitely doable and worth it. If that's what your heart is, it's definitely worth it. So not easy, but definitely worth it. And there's a lot of support, your teachers, your classmates. If you have friends or acquaintances that are already in the health field, I recommend reaching out to them for any questions, any guidance. That's something that I always hesitated to do because I didn't want to, seem or feel dumb or ignorant, but definitely reach out to whoever you can because any help is definitely helpful for the program.
Thank you.
Yeah.
You mentioned one thing, which was you opted to do, was it an accelerated RN program or was this one the LVN one?
For both. So I chose the accelerated program because I was thinking I need to start working ASAP because I have to provide for my children, pay rent, bills. So for me, the accelerated program was a little more doable for me because it's a shorter program. And I was able to get my license a little faster than the traditional way. So that worked for me. But definitely, I think if I didn't have so much pressure, I would have gone through the community college and then transfer, just because it's I think you can have a better school work life balance that way. So I recommend it if you're able to do it that way. I definitely recommend that way.
Thank you. I was really curious because the word accelerated is in there, right? So I was wondering, like, how much time do you think it would take a more traditional student or in a more traditional program rather than accelerated? Is there like a big time difference?
I would say yes. I think for example, the LVM program at a private school is about 13 weeks, where I know as a community college, you have to have your requirements first to be able to enter into the nursing program, whereas a private school and accelerated program, you do your prereqs while you're doing the actual nursing program. So it's a lot more expensive though. But if I worked nights and I was making monthly payments to avoid taking out a personal loan or student loan. So there's different ways. It just takes a lot of hard work and sacrifice.
Right. So you mentioned that one of the things that was beneficial was that you could kind of make the payments in installments rather than just like giving it all up.
Yes. Yeah. So whatever grants I was able to get with FAFSA and any kind of help, whatever leftover balance, a lot of students get personal student loans, which is great, but I rather make the monthly payments to avoid, all that later on.
Yeah. You mentioned FAFSA too, so they were able to accept federal aid as well.
Wow. Yes, they do. Mm-hmm. Yep.
That's very beneficial.
So that's very helpful.
I feel like sometimes students might not be too sure. They see like the big price tag for these private programs, but then they don't understand how financial aid can cover some of that.
Yeah, so it does cover a lot of it. So it's very helpful.
All right, thank you. The next question we have for you is, what were some of the biggest challenges you faced while pursuing your nursing degree, and how did you overcome?
So for me, it was very hard at first to have that work-life balance. For a little, I kind of had to accept that I was probably not going to have a life for the next, let's see, for the RN program, it was 16 months. So I knew for 16 months, I was not going to have life. So it was really hard for me to be able to manage my time. So that was a big challenge for me, but I was able to learn from other students, just being very organized, having a planner and organizing your time, and really being very let's say like strict, on how much time you spent on something. Because if you don't, you can easily just fall behind. Everything just piles up, the studying, the tests, the homework, the projects, the essays. So very important. That time management is very vital when it comes to the nursing school. And it actually helps a lot once you're actually out in the field. It helps with your personal life as well. So I really recommend practicing that while you're in the school.
Thank you. Super important. I mean, I think it's very not spoken enough about of how important the whole time management aspect it is to your success in achieving this, because as you know, in general, we live in San Diego, but in general as well, like when you're a community college student, there's so much going on, and there's many reasons. You alluded to like flexibility and different types of academic programs that aren't really traditional. And it
Mhm.
works more for me because I grew up, low income. I grew up in a rural community where we didn't really have that many opportunities for college.
Right.
And something like that would have spoken more to me because it's faster. There's aid available and things like that. And then also learning how to manage through that throughout the process because it sounds like the LBN program was a lot shorter than the RN program, right?
Right. Right. Yeah.
And then Chris will ask you the next question.
Okay. How has your Latinx, Chicanx identity influenced your experiences and perspectives in the nursing field?
Um, it's, you know what? It's actually been great because my experience has been really good because a lot of these there's a nursing shortage everywhere, and there's even more Spanish speaking nurses shortage. So being able to speak another language, and especially Spanish here in San Diego, is very important. So agencies, companies, hospitals, if you can speak another language, you're very valuable. There's a lot of companies, they actually pay extra if you know Spanish, or another language. For example, for me, it's, being able to have come from like a Mexican culture and being able to speak Spanish, I'm able to help the agency or the hospital or whoever I'm working with help, Spanish speaking patients that have the same culture as I do. So being able to help these people is great because they feel a lot more comfortable when they understand the same language, the same expressions, the same culture. So that's been very helpful for me, and it's something that a lot of employers value. So it's been a good experience with the in that aspect.
Wow. I really like how you said there's a nursing shortage, but there's even more of a shortage for those that speak Spanish.
Yes.
And that's one of the things too that living in San Diego, I saw that there's a lot of folks that don't actually speak Spanish. Whereas like back home where I'm from in Imperial Valley, although the official language is English, like almost everyone speaks Spanish. So it's like the informal, unofficial, official language of
Right.
being back over there. So
Yeah.
our next question for you is, can you talk about any mentors or role models who supported you throughout your education and career?
Yes. So I have had a couple teachers, actually professors that I attended their classes, and I actually became very close to them when it came to that, asking questions. Um, the health field community is very little, so a lot of people know a lot of other people. So being able to get to know professors, getting to know other nurses, getting to know supervisors, comes really it's very helpful because they're able to guide you. So I always recommend, if you have a chance to build a relationship with someone with experience, I definitely would do it and take advantage of that because it's happened to me many times where I bump into an old teacher or an old coworker, and they're able to help me get hired at wherever I want to get hired because they know people there. So I've had a lot of mentors in the past 12 years that have helped me with either taking a class that I need for a certain job or a certain agency. So that's always been very helpful. So I recommend keep in touch with them, exchange emails, phone numbers, because I feel like at some point you are going to see them somewhere, see their name, or networking. So I have had a lot of old professors and old teachers that have helped me even get jobs. So yeah.
Yeah, I agree. That's super important.
Let's see. What advice would you give to Latinx, Chicanx students who are considering a career in nursing?
Um, Definitely be prepared. Especially with clients, you have to really build that thick skin, especially with different cultures. I have been working as a home health nurse for the past 5 years. So it's kind of like a mobile nurse. So I have to go into these patients' homes, different cultures, different ways of viewing things, different mindsets. So it's very important that when you are providing care to a patient, that you remember that they have their own culture and their own ways of seeing things. A lot of them come from different countries, weren't even raised here. So I always recommend that don't take anything personal. I've been spoken to, you know, in ways where normally I would get offended, but because I know that they come from a different culture and different ways of seeing things, sometimes they speak differently, even where I think they're angry, but they're not. That's just their culture. So it at first it did kind of affect me a little bit, but then I was able to understand like it's about the patient, it's about how they view things and how they feel. So in that when I'm in that situation, I just try not to take anything serious, anything personal. I'm there to provide the care that they need. And so that's something that I always, tell new nurses, like, don't take anything personal, just try and just be understanding. And what I've always done too is I always try and learn a little bit about everybody's culture, so that's been very helpful for me.
Thank you so much.
Yeah.
And how do you balance the demands of your job with maintaining your cultural heritage and community connections?
I fortunately, it's been an advantage for me to be able to, because like I said, there is a big shortage with Spanish speaking nurses. So it's been a good thing, because I'm very proud of my background and my roots and my culture. So when I'm able to be somewhere where I understand that we have the same culture and same background, it's it's very rewarding knowing that this person can connect with me, where I know they've had other experiences where they can't really communicate, they can't really express how they feel or what their needs are. So that's something that's been very helpful for me to be able to have this understanding that not everybody has. So because of that, I'm able to be able to work in an area where there's, more of the same culture, more of the same language, more of the same needs. But the only really a negative experience I've had is just where, there's a different culture and they tried or they think that I will automatically understand, where they're coming from, especially with a new culture that I've never really worked with.
Yeah. Yeah, I there's a lot of educators that believe that language as a whole is an asset because many times many students have been told like no, don't speak whatever you know, just speak in English, right? Because that's the official language. So
Right.
yeah, what I see and what I'm hearing from you is that it's most definitely an asset. It's a really big strength that you are able to speak Spanish. And oh hey,
Yeah.
oh my gosh. So sorry, someone sneaked in here on us and I was surprised for a little bit. Okay. So yeah, so thank you for sharing about that. And our next question is,
Have you encountered any cultural barriers or biases in the workplace, and how have you addressed them?
So for that, it's been luckily, fortunately, it hasn't been in the actual like from the employer, but mainly from clients. That's where I've had some barriers where I go into a home where I'm not familiar with their culture or with their language. I've had to learn to be able to come into a patient's home with the mindset that they have their own way of thinking, their own culture, their own language. So those are one of the barriers that I've had, but um, with time, I've been able to learn a little bit more about every culture, or at least the cultures that I come in contact with frequently during at work. Um, but like I said, it's very important just to build that tough skin, and to be able to just focus on that patient and how they see things and how they feel on the patient care that we provide. So it's mainly just being considerate of their feelings and their beliefs.
thank you so much. And what do you think? I think that you've already touched on a little bit about this, but as someone who identifies as Latinx, Chicanx yourself, what are some of the unique perspectives or strengths that you believe nurses can bring into this healthcare field? And I think that
Uh,
language for sure is definitely a big one of them, because of that whole aspect of you being able to connect with certain patients, right? Because I would definitely assume that if you speak a language that a patient does, they'll be able to connect with you on a different level than they
right,
might be able to, than they might not be able to with someone who doesn't, right?
right.
Do you have any insight into any of that uniqueness or perspectives for yourself?
Yeah, I mean, when I first started working as an RN, you do a lot more teaching to a patient, a lot more education. So something
Mm,
that I learned is that I lacked a lot of confidence, because English is my second language. Or sometimes I felt like other cultures will look down on me because, I'm Mexican or I have an accent in English. But something that I always tell other coworkers or people that I mentor is just be confident, and if the patient sees that you're confident in what you're doing, then they'll have confidence in you, regardless of how they look at you or talk to you. Eventually, at least my experience, I've had experiences where I feel like I'm being spoken to in a like a rude manner, or they were expecting somebody else. But I've always been confident in what I do, and I do it with a lot of care and a lot of love. And regardless of how they feel about me, I'm there to provide the best care that I can. And I take pride in my culture and I take pride in what I do. So, um, you know, I always just try and make them feel comfortable. And if I'm able to connect with them in that way, that's even better. But I always recommend, be confident. And I always with the nursing in the nursing field, I feel if you don't do it for the right reasons, you probably won't enjoy nursing, to be honest with you. You have to really love helping people, want to make a difference in someone's lives, because nursing is definitely not just physically, but mentally and emotionally, it can be a lot every day.
I think you really hit it on the nail when you were talking about a lot of the unique things, because one of the main things that sticks out is the language, but also you mentioned kindness.
Mhm.
And you mentioned that in some cases that might not necessarily be reciprocated, but how you
Right.
are will also help you get through those experiences emotionally. Because
Hmm.
I'm a firm believer kindness does go a long way. I think that here on the college campuses, us being kind to students and letting them know that they're welcome is going to give them the opportunity and let them know that they can show up to these spaces, because I don't think that's really a
Right.
big thing at community colleges. Think about it, right? Community colleges, students don't live here like they do at universities. They're getting their classes in and they're pretty much, they know that they're going to go home, right? So that's what I love
Right.
about here. I feel like they're actually doing a lot more programs and activities for students that honestly I haven't really seen at community colleges before. So thank you for that.
Yeah. Yeah.
Um,
Okay. Can you share a memorable experience from your nursing career that highlights the importance of cultural competence in healthcare? It can also be how an employer shows they value diversity, equity, and inclusion.
Yeah. So I have one of the things that I love about nursing is being able to meet a patient that's in a very like vulnerable position where they're in pain, uncomfortable, or they have a big wound, and being able to see them like months later and seeing them healthy, seeing them healed, seeing them happy,
mm,
is just so it's like priceless. It's priceless to be, because I have bumped into patients out in public, and they remember me, and they run up to me and they're happy and thank you, I remember you, you were such a good nurse. So that to me is like, wow, like I actually made a difference in their life. And I see them now here months later and they're healthy and they're walking and, whatever the case was. I've had patients where we become friends, we stay in touch and um, I'm able to, see the things that nursing does for someone because we're not, we don't see patients as just a medical record number or just a diagnosis. Like we see them, we talk to them. I go and I do their wound dressings and a lot of these patients just want to vent. They just want someone to talk to. So it's something good where I know I'm not just helping them physically, but sometimes even emotionally when they don't have anybody. So a lot of uh, a lot of good things come from nursing. A lot of good things comes from helping others. So this is a career where I don't see myself doing anything else. So, like it's very rewarding, definitely very rewarding.
Thank you. We have the last question for you already.
Okay.
That was pretty fast, huh? Okay, so what are your future goals in nursing now that we know you're going to stay in the field? And how do you plan to continue growing both professionally and personally?
So with nursing, there is tons. You can take nursing in different directions. You can do hospital, you can do mobile nursing, you can have your own business, you can do administration. I've had a lot of ideas, while I experience so much, but I think right now, what I want to do and I plan on doing, hopefully, God willing, is being able to open up my own company. I want to do IV infusions and hydration, because I enjoy the gym and there is a lot of events for hydration, like competitions, marathons, hydration parties, working for labs. So that's something that I think that I want to do. I want to be able to have my own IV infusion company, and hopefully things go well. But there's so many things that you can do with an RN license. So much to do to open a lot of business out there. So that's something that I have in mind to be able to have my own business and be able to provide care to the patients, how I want to provide, which is, always my goal is to provide excellent care.
That's amazing. Thank you so much. Because
Thank you.
I think one of the expectations that people have is that when I go do nursing, I'm typically going to be working at a hospital. But what
Yeah,
I'm hearing from you
no.
is that you can be um, doing mobile nursing, right? Like visiting people at home, taking care of them. You can even start your own business and do multiple things.
Right.
Because I feel like there's a lot of skills, right, that you learn as a
Mhm.
nurse, different
Right.
services, different types of things. So that's really exciting. There's nothing but bright things in your future, no matter what it is that you decide to do.
Thank you. Yeah, there is. So I always encourage, if you want to do nursing and you get tired of patient care, there's
Mm,
always tons you can do. You don't have
yeah.
to work with the patient. You can take a break and do administration work. There's a lot you can do. You can be you can teach, as a nurse. You can be a manager, you can be a supervisor, you can have your own company. So there's tons that you can do with nursing. You're not stuck with just patient care.
Thank you so much. Is
Yes,
there
thank
any
you.
way that students can stay connected with you, whether if it's an email or like social media handle, anything?
Yeah, definitely. I will give you my social media information, my email, so you can give it to any student that has questions that needs help. Even with any questions if they're already in the RM program or LVM program, I can help with any questions that they might have, or hiring or as a anything that they need.
Thank you so much. Do you
No
have any
problem.
questions for Olga? No. Okay.
Thank you so much.
Thank you guys for everything. You guys have a great day.
Thank
Oh, you
you. I'm
too.
gonna stop the recording before we end. Oh, actually, guess I have to do it through here. Woo. This is interesting. Okay.